So what do you see if somebody has turf toe? If somebody, like maybe you guys are training somebody and it occurs on the field, you're going to see swelling around that first toe joint, right at the joint there. You can see swelling there. You can push around. They're going to have tenderness on the bottom part because that's going to be forced backwards. You're going to have tenderness underneath there. And they'll also have probably tenderness going down into their foot as well, because those muscles that attach to the toe extend down into the foot. You can look at different testing. This is different testing that we do. You know, you assess the motion of it, see if it's normal to the other side. Is it less to the other side? You always compare it to the other side. You can do like a little drawer test where you can actually grab the toe and actually pull it upwards, push it downwards, see if there's any excessive movement. You can see if they have strength there. Ask them to push down against your finger, push the toe down. If they can't do it, that means the tendon's ruptured as well. So they have some muscle injury as well as the capsular injury, as well as the soft tissue. It may be too painful for you to really test it, but it's just a simple thing you could do right then and there on the field. So what do you look at for imaging? So you look at weight-bearing x-rays again, from front to back, side to side. They might see little flecks of bone if the tendon pulls off the bone. If there's any suspicion of fracture, obviously they'll send you for more testing. This is what it looks like on x-ray. So this is a lateral view. So you can see how far up the toe flexes. So you see this down here, this should be down here. So what they do is they actually try to hold the toe up, lift your toe up, and they see how far it goes. If it goes way too far, there's nothing holding it down. So you can tell right away. There's no stabilization there. Here's another way it looks on the toe. This is a top to bottom view, obviously. So you can see these small bones here are the sesamoid bones, all right? They actually should be here. This is the good side. This is the bad side. So what's happening is this is torn here. There's nothing holding them up here, and they just retract down this way. So that's another way they can kind of see if the thing's torn or not on an x-ray. MRI is useful. You can identify the soft tissue damage, obviously. They can use it to classify it, what type of injury it is. And this is what it looks like. So this, again, is the tendon right under here, or the ligament, sorry, ligament. And this should be continuous. This should not be white here. It should be like a whole continuous thing. So that's a really classic case of a turf toe.